Hey guys, it's Dr. Justin Marchegiani here. Today is March 23rd. We're going to do a little coronavirus update. I'm going to review some of the stats across the world. I'm going to give you kind of my feelings and my opinions on things. My opinions are all based off of the data. We also have to bring in perspective based on other trends going on with different diseases. Context is everything. If we don't have comparison, then it's hard to know what's normal, what's not, and it's easy to go into freak out mode. So overall, my goal is today is to really calm down the hysteria like it is every day, and you guys can think better, be smart, and make better decisions based on your health, where you're at personally, and I'll give you some good options here today. All right, so off the bat, where are we across the world with coronavirus? Well, this is going to be a live video, so put your comments down below as well. Love to answer them. So first off, where are we? Let me just put on my little infographic on screen so we can chat a little bit more about that. All right, cool. So let's go to the overall stats here for today. All right, so United States, 64 deaths so far today. Yesterday, we were at 117. So we're climbing still, but in general, we had a nice drop today. We'll see if that drop continues at the 64 number. We'll see. When we go down here and look at it and graph it out, daily deaths is the graph that you want to look at, because what's going to happen is there's going to be a bell curve in which the virus is going to move through cyclically. And so far, countries have been able to move that bell curve through in 4 to 8 weeks. China and South Korea both have. And so typically how it should look, this is the generalized bell curve here. You're going to see end of January, we moved through coronavirus daily deaths. We topped out 3 to 4 weeks later. This is kind of where we're moving into now. Like we're at the equivalent of like February 11th to like February 15th right now in China. We move through this general cycle and then we come right back down. That's the goal, is that we're going to move like this. And again, what we're doing here is trying to flatten the curve. So by some level of quarantine or social isolation to this curve here, this is where it could be. And then we're trying to flatten that because this is the healthcare system's capacity over here. So we're trying to mitigate that, keep it under wraps. So we're trying to bring that curve down, which is novel, right? We have to weigh the facts of the damage of destroying our economy and flattening this curve. And we have to weigh that because it's very damaging people's health after the fact, not having a job, losing their life saving, losing resources, not being able to support their families adequately, the homelessness, the suicide, all the stuff that may happen as a result that may kill actually far more people. So we have to weigh both of these things, and we got to have reasonable recommendations that make sense. And we also have to know who is the risk factor, like who's at risk here. So I always like to look at who's at risk. So 80 plus year old people, right? 70 plus, 60 plus. If you look at the range here, 50 to 59, 1.3, 40 to 49, 0.4. So you have about 2% under the age of 60, 2% out of all the mortality. The other majority are going to go up the other direction to the 60, 65 and up. So these are the people I highly recommend quarantining. Most people are quarantining right now. I'm currently quarantining. And the reason why I'm quarantining is not because of me or even my family. It's because I want to take stress off of the healthcare system. I want to make sure I don't infect anyone else, because the odds are, right, according to research so far, 10 to 20 times the amount of people who get the virus are going to be carriers and be asymptomatic. So for every one person that tests positive for coronavirus, you're looking at about another 10 to 20 people not actually having symptoms. That's pretty profound. And we'll talk about the pandemic math and the hysteria math and why the math makes people go off the deep end. So in other words, we have a person that dies, okay? We figure out how many people, for instance, get the virus and then the person that dies. So if we have 10 people get the virus and one person dies, right? That's going to be a death rate, a mortality rate of 10%. Okay, and then if that number, if the more people that get the virus, that mortality rate drops. Okay, so that's easy to understand. Now, when you're in the middle of a pandemic, what happens is the 10 people that you know tested serologically positive via testing, we hope that we know that they got the infection, right? There's always the testing false positive nature. Lots of documentation. I'll show you a peer review study in a minute where people are testing and they're coming back false positives, 50% plus. But in this example, 10 people we know have the virus. one person dies, that's a 10% mortality rate. The problem is the 10 people we know have it, there could be upwards of 100 to 200 people that actually have the virus but aren't showing symptoms, therefore they didn't get tested. That's where the math becomes tough because we don't know that bigger number, and that's why mortality rate looks super, super, super scary. All right, so with pandemics or viruses that we have more history on tracking, like the flu, we know the flu, for instance, kills about 22 to 45,000 people a year. We know that 1.2 million people are tested and 220,000 actually come down with the flu. Now, from that math, we run regression analysis, and that tells us the bigger number. And that bigger number is about 35 million people a year get the flu, 222,000 test serologically positive, and we do the math based on the 1.2 million samples the CDC gets a year. That's how we get the bigger number of flu. We don't have the bigger number for coronavirus. We will. So for instance, let's go back to, I'm going to use previous examples for context, okay? People may say, well, this coronavirus is novel. Well, swine flu was novel too. Let's go back to '09. Swine flu was relatively novel, right? There's different, like you have H1N1, H5N3, there's different ones, but swine flu was relatively novel. At the time, we didn't call a national emergency till 1,000 people were dead. 100,000 people in this country were killed and 1 million worldwide. The World Health Organization said, I think it was in the kill, I think over 1 to 2%. And ended up being revised down to 0.01%, ended up being revised downward 63 times. And this is because of pandemic math. It's because we don't have the enough data points in the moment to run the regression analysis to figure out how many people truly got infected, because the asymptomatic number, how many people get the infection but don't show symptoms, that's the missing variable here. And once you actually have that variable, this whole thing looks less scary. If I come and tell you you have a 1%, or if I come and tell you, hey, coronavirus has a 1% chance of killing you, but then I say, hey, by the way, there's actually an 86 to 90% chance that you're going to get the coronavirus and you'll have no symptoms and you'll have lifetime immunity forever. I mean, which empowers you more? Which takes you out of fight or flight? Which makes you feel more empowered, right? Obviously, the latter. So you can look here. Let me just show you one study. Let me go hunt it down here. Okay, so this is the false positive rates among testing. You can see here about over half to even 80%, Where is it? Yep, so false positives among COVID-19, nearly half, even more of the asymptomatic individuals reported a false positive. And then up here, it shows even 80%. So keep that in the back of your mind. And this is the one I wanted to highlight. We estimate 86% of all infections were undocumented. And the definition of undocumented is they test serologically positive without any symptoms. And again, the head CDC person over, I think it's in Ontario, said that there's more than likely 20 times the amount of people who have the infection and are asymptomatic. So here's one study, and 86%, by the way, that's about 7.1 times. So for every one person that has it, 7.1 people have no symptoms. The head of CDC version up in Ontario said it's up to 20 times. So we know this is significant, all right? We know there's a lot of false positive, and we know there's also a lot of asymptomatic, okay? Keep that in the back of your head. All right, let me keep on rolling. I got a lot of info here for you. We talked about this here, 86%. Let me give you a little bit of corollary here on what's happening in Italy. Okay, so first off, here's our influenza death by week. This is really nice. So 2020, we're about 400 to 500 people pass here per week when it comes to the flu. Maybe more because there's a lot of pneumonia that's caused by flu, and sometimes that doesn't get, added, right? The biggest viruses that kill pneumonia-wise are going to be like flu. Then you have RSV, and those are going to be the big ones. So off the bat here, when we look at the statistics from the CDC, just last week alone, 487 people died, okay, of flu. All right, so we're a little bit less than that right now of corona. I want to say the stats for coronavirus, if we look here, are at 483. So we had so far in about, let's see, first case of coronavirus first death was March 2nd. So in about 3 week plus, we are matching what we did last week in flu. Just to keep the statistics, equal so we can see. Now, we have countries that are being hit really hard, like Italy, right? Well, why is Italy being hit hard? Well, there's a lot of different factors. I'll go over that here in a second. Number one, Italy has one of the highest average age of senior citizens. So, I think there's I want to say there's over 7 million people in Italy over the age of 70. A lot of smoking, a lot of multi-generational households, meaning grandparents, parents, kids, all in one household. A lot of smoking. I would say another big thing is the travel ban ended up being a really, really big thing. Getting that travel ban under control and decreasing exposure from Chinese citizens to Italy really made a huge effect here. That's why we're not getting hit as bad. Now, there's a couple other data points here. You can take a look at this article in the Telegraph. I'll pull it up here, which is very interesting because they were looking at Italians and how they were classifying a lot of the deaths. Okay, here's the article. And basically, why have so many coronavirus patients died in Italy? There's a couple other articles on it, but basically one of the big premises when people die in Italy, if they have the coronavirus but also die, let's say, of a heart attack, they may get classified as died of the coronavirus. So there's this conflating variable of a lot of elderly, a lot of comorbidities, right? Meaning multiple diseases. You die of cancer, you die of diabetes, you die of a heart attack, and then you also have the coronavirus, and then that death rate gets marked as the coronavirus actually being, an incident for coronavirus. It's one tick in the coronavirus's column that may artificially stack up and increase, the overall death rate higher. What we have to look at after everything's said and done, countries actually do the overall mortality rate for each country, and we have to actually look at the mortality rate and see if we see spikes above and beyond the mortality rate. Because one of the big things we're going to see is we may see a drop in flu, but we may see coronavirus peak up, meaning that person that died of coronavirus may have died of the flu next month. So there may be like a give and take on the corona versus the flu, kind of like a tug of war. So we're going to have to look at the overall mortality rate to see if we actually have spikes in mortality rate over statistical norms over previous years. So that's going to be really, really important. All right, let's go look at the data. There's a lot of stuff to digest here. So here are the stats here. United States, 64. So yesterday we're at 117. So we'll see if we start to, let's say, round the bell curve. I'm hoping that we're going to start to round the bell curve soon. Italy was 651. Now they are 601. So they went up a little bit over the weekend, right? They're on the higher end. We'll see if they're starting to flatline here. Like I mentioned last week, because we have the bell curve data from China to look at, and we know how various viruses fluctuate. They're not logarithmic where they go up forever, right? They go up and then eventually they plateau and they go down. Now, one thing I want to highlight here, I listened to an interesting interview by Paul Offit, and you have lots of people saying, hey, flu is not as strong as coronavirus. Coronavirus is more virulent. It spreads more. But we're not really seeing that, right? We hear that, but the data does not point to that. Let me tell you what I mean. Paul Offit in the video, he's a big vaccine guy, so people may not like him, whatever, but if we just take what he's saying kind of at face level, he's saying that there has to be a fecal oral component to this bat coronavirus. We've had 4 coronaviruses at our time. This is number 4. SARS and MERS were the more recent ones in the last 15 years. Paul Offit said there has to be a fecal oral component in the coronavirus because if we look at the incident data in South Korea and China, it didn't spread that much. It didn't spread it to that many people relative to the whole population, right? So we see in the United States, we typically with flu, 10% of our population comes down with flu, right? 10%. So if we look at China, what's 10% of China's population? Well, 1.2 billion, that's 120 million people is 10%. We're not seeing 120 million people come down with coronavirus, right? So the infection spread, if it's truly a respiratory infection, meaning it's spread with respiratory droplets, aerosolized droplets, we would see a way, 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 way higher incidence, and we're not seeing that. So Paul Offit's perspective on it is there has to be a fecal oral component in how it's transferred, meaning stool to fingers, to hands, to mouth, whatever. There has to be some transfer there because we would see the incidence off the chart. And we wouldn't have seen China or South Korea be able to go through that bell curve as fast as they did with the smallest amount of deaths and the incidence being as low. So when we look at China's daily deaths, right, we're at, I think, around 3,200 and change, and the amount of people that actually got the infection, yeah, so 3,261 for deaths, and then all of our active cases, they ended up having so far, the highest amount they had was 58,000. So people saying, hey, this thing is spreading, it's more powerful than flu, or it spreads worse than flu, we're just not seeing that in the data. About 10% of our population comes down with flu a year. We're not seeing other populations where 10% or so are coming down with this virus. Not yet. Now, we'll give it time. It's always possible that data is incorrect. Who knows? China could be lying to us. But we also have countries like South Korea that we can kind of look at. Now, South Korea did excellent. Here's an article that you can take a look at. It's called South Korea's reports lowest numbers of new cases in 4 weeks. And then why did South Korea actually do as well as they did? Well, anyway, you can go look for that article. Let me put it up here on screen. So essentially, South Korea was ready for this because South Korea actually had a case of MERS, which is a Middle Eastern respiratory syndrome, and about 40 of their citizens died. I think this is about 8 or 10 years ago. And because of that, they had their testing and their protocols and their systems all ready to go. Now, people talk about testing is like so essential. Here's the deal. Testing helps get a global big picture of what's happening. It helps governments be like, okay, there's a pocket here, there's a pocket there, and they can apply policies and quarantine measures more specifically. I'm just using reason, logic, and evidence, right? Knowledge guided by experience. Okay. Everyone that is a higher age, and by the way, South Korea did not shut down their economy. Their economy kept open. From what I understand, Dr. Oz did an interview on this over the weekend. He's like, hey guys, South Korea did not shut down their economy. What they did was they just said, hey, if you're sick, you're old, you're immunocompromised, you're quarantined. Everyone else go back to work, but use common sense things like washing your hands, social distancing, all the good things you need to be doing. And they didn't spread. Now, they were on top of their testing, but testing doesn't treat. And if you just already know, according to the data, the higher risk factor people, you quarantine them. Everyone else does good common sense stuff. This thing's going to have to work its way through anyway. And then also the people that are older and more sick and more immunocompromised, they tend to already be out of the workforce, meaning retired. So my thing is, it's this balancing act of what's worse, the virus or the damage to our economy. And I know the damage to the economy will be around a lot longer based on this 2-month bell curve to get through the infection. Okay, so a couple things here. So China, this is the overall bell curve to get through the infection, 2 months about so, okay? Let's go look at South Korea. South Korea here as well. So you can see they had a couple of pop-ups here, but in general, this trend is dropping, and I think their other trend for today is going to be lower as well. But if you go up here and you look at the incident rate, look at daily new cases. So it's just a matter of time before this all drops, right? Because their caseload is just dropping, which is really, really good. You can see Italy's actually here. They're popping down a little bit. They may go down again today. We'll have to wait to get their stats in. The big thing with Italy is I think their cases are dropping as well. Yep, so they had a little bit of drop in their daily new cases. So I'm hoping, right? Again, I said this last week. I'm like, I think Italy's about a week and a half away from getting to the top of the bell curve. Here's the bell curve for China where it was, right? A couple of pops, and then it continued to go down. And I'm hoping that's where we're at with Italy. U.S., you can see here, daily new deaths were 117, but yesterday we were down in the 60s, I think, or 50s. So that hopefully is dropping, as you can see. And then you can see the overall daily new cases is still up. And again, the whole new case thing is interesting because of the testing and the false pauses in the testing, right? I showed you the data here. Let's see here. Yeah, I showed you the 50% false positive, meaning asymptomatic individuals. They actually test positive. Or I'm sorry, this is the asymptomatic test, right? And the false positive is here. No, I'm sorry. This is the 86% are asymptomatic, and then the false positive here. Nearly half or more of the asymptomatic infected individuals reported a false positive. That's that one. So as you can see here, we're going to have to just keep a little bit of an eye on the data. Now, one thing that's interesting, look at Germany. So UK is popping up a little bit here as well, so we'll have to see. Their deaths just dropped down here today, so we'll have to keep an eye on them. If we go back and look at them on day one here, where they're at today, UK is at 54. Yesterday, they were at 48. So they're kind of still popping up a little bit, the UK. We'll have to keep an eye on them. And then also Germany. Germany's, I think, coming to the top of the bell curve, right? Look at them. March 8th, here's their daily deaths. I mean, look, there's the top right there, 24, and they're starting to come down. We have a couple of data points in a row. So Germany may have really knocked through this thing just like South Korea. This is going to be quite interesting. And let's look at their caseload. Yeah, so daily new cases are dropping. So if you look at the data like this, it becomes not as overwhelming. You can kind of digest it because you can look at the trends, right? When you see the trends, you have a lot less fear. And then just know if you're in the U.S., we got about 500 people or so dying a week of flu. So if you want a relative, that's on average. That's throughout the whole entire winter on average, right? So keep that in the back of your head. So when you're doing research on this and you want to have some perspective, it's very, very helpful to compare that so you don't get overwhelmed. I hope that helps. Let me go over a couple more data points for y'all. So Germany's looking good. We already talked about that. We talked about Italy. Hopefully they're coming down. Oh, one other thing I want to show you. This is helpful. Because when you look at absolute numbers of data, the problem with absolute numbers, total cases, is you get some country like China, right, who's got like 1.2, 1.3 billion people. And then you got a country like UK. What's UK? Like 20 million? I'm not sure. I know South Korea, for instance, is like 50 million. So you have to look at the numbers per million. So I like to do total cases per 1 million. And I like to filter that. So I'll do that. And then I can see here, okay, so these are the ones that are going to be the highest. These are really small countries, so a couple of numbers boost them up a lot. But obviously, right, forget about them. Let's go to the actual, like the G20 countries, right? Italy, Switzerland, Spain, Monaco, Austria, Norway. Now, look how far you have to go down to find the U.S. I mean, you have to go down like 35, 40 deep. So what does that mean? The U.S. is actually doing pretty darn good. If you're watching the news today, you're probably not going to think that. You're probably going to be like, holy crap, like the world's coming to the end. But data-wise, that's not really the case. So it's really good that we're on the right track. And we're going to be on top of this, and we're going to, continue to work here and be on top of this bell curve and flatten it. I'm thinking the economy, based on some of the data I'm looking, they're probably going to open up the economy in the next week or so, I'm thinking, but still quarantine everyone else who is sick, immunocompromised, elderly, all that good stuff, just to be on top of it. And I've already talked on previous episodes here. No one talks about boosting up your immune system. Guess what? Washing your hands does not boost your immune system. Social distancing, quarantine does not boost your immune system. But what does is good, clean water, hydration, excellent kind of a paleo template diet is going to be helpful. Again, these are general advice. A lot of people, maybe like, well, I see patients and I work with them specifically, and we do nutrient testing and really customize things. But generally speaking, for the general population, for the Gen Pop, vitamin C, excellent. Vitamin A, excellent. Zinc is going to be excellent. Astragalus, medicinal mushrooms. These are all going to be excellent nutrients and or herbal compounds to upregulate your immune system. Now, I've given the advice before, but vitamin C to bowel tolerance and back off. So usually 5 to 10 grams a day is usually pretty good. Vitamin A, I'd stick to some cod liver oil. A couple of tablespoons a day is fine. Zinc, anywhere between 20 to 40 milligrams a day of a good picolinate or a bisglycinate's fine, or an aspartate's fine. In regards to astragalus, you can do 300 to a gram of astragalus today. In general, with reishi, I love my reishi mushroom. I'll do anywhere between 1 to 3 grams per day, and then acutely up to 5 grams is fine. And then, of course, with other herbs like NAC, I'm doing 2 grams of NAC a day. That's a great expectorant. It calms down the mucus, dries out the mucous membranes, and it's shown to help decrease viral replication. And elderberry is great as well. Now, a lot of these compounds, there's no cure here. What we're trying to do is upregulate the immune system so we can have such a strong immune system we can suppress the virus from even docking on, or we can modulate our immune response so we can knock this thing out faster. Some people are reporting of literally having the virus and in 24 to 48 hours, done. It's over with. Some people are reporting, hey, this is awful. This is really, really bad. And people are like, oh my gosh, like, someone who was really young, an 18-year-old kid died, and they're like hyping it up. And I'm like, I go on the CDC website, and I'm like, well, how many people died of a flu this year that were children, that were pediatrics? There was 140 cases. I'm like, all right, so this isn't that uncommon for flu. But when you just see it out of context, like, ooh, 12-year-old dies, you're like, oh my God, this thing's so bad. But then we compare it to the flu and we're like, oh, 140 have died this year already of flu and have been pediatric patients. So context is everything. It gives you a way to kind of filter it all and put it in the right frame of reference. So I hope I gave you some good information. Go back, look at some of my podcasts, my videos, a lot of great information, totally free. If you want to work with me or dive in directly with me, click down below to schedule if you want. Subscribe, get great info, and also thumbs up. Really appreciate it. Sharing is caring, and put your comments down below as well. All right, guys, have an awesome day. I'll be back. Take care. Bye.